My name is Maria, and I'm an equity research analyst here at Erik Penser Banks. And with me here, I have Pia Hedin, CEO of SensoDetect. Please, Pia, the scene is yours.
Thank you. First of all, I'm very happy to be here. I'll do it in English, so that's okay. So I'm Pia Hedin, Per Anders. I'm the newly appointed CEO at SensoDetect. We are a Lund-based company. We're actually born and bred in Lund, from Lund University. We offer a 14-minute test to detect the prevalence of ADHD, ASD, and schizophrenia. But we do also have a broader platform, which I will also go into at a later stage. We offer, as our founding father said, Sören Hysén, actually a doorway into the brain. It's based on hearing, so the test is a 40-minute hearing test, basically. It's exactly the same test that has been done to newborn children when they were suspecting of not being able to hear sound. So it's completely harmless. It is based on our founding father Sören Hysén and in Lund University and the Department of Neuroscience. And as you can see in the picture here, he is a psychiatrist, but he was also a great musician, and he played the same sound to the schizophrenic patients that he had, and he realized that they all reacted the same as a group. And that's the basis of the whole research and our company today. As I said, we're based in Lund. We've been there since 2005. Sören and many others have researched this area for almost 30 years. And originally we were, as you can then realize, a research-driven company. Now, since 4 to 5 years ago, we shifted and turned into a more market-driven company. I've been in the company for about 1.5 years, but as a CEO since last autumn. So I can now say that we are a reborn company. We are now digitized. We are kind of remade in the way that we can actually offer our services to our clients. It's a faster service today. But most importantly, we're still clinically 100% proven, and we are an objective tool to measuring the diagnosis that I mentioned before. We are also in the spotlight market, of course. Key missions. Number 1, use diagnostic aid for ADHD, ASD, and other mental illnesses, such as schizophrenia. I would like to point out that ADHD and ASD is not a mental illness in that sense. It is a disability diagnosis. As a second mission, we are to improve efficiency and costs, and also costs to the society and the families surrounding. So I said previously that we are a platform-based company, so that means that we can expand, of course, to different. Each area we expand into, we are surprised ourselves that it actually is such a good method. But for now, and as I said, we're market-driven. We need to focus on the right subject. So we are now chosen to focus on ADHD, ASD, and schizophrenia. The reason, as you can see in the slide here, simply put, ADHD is about 5 to 7% of all children and adolescents in the world, and 2 to 5% of all the adults. ASD is not as common, but it is actually risen quite a lot, specifically in Scandinavian countries. And schizophrenia is, of course, because that is a disease that is sometimes very hard to distinguish from, for instance, psychosis. The clinically proven part, this is an excerpt of one of the many studies that we have on our webpage. You're welcome to go in there under investigations. But it shows that we have a specificity and sensitivity of almost 90%. Which is extremely high. So, why do we exist at all? Well, as you may have heard in the news and in the media, ADHD, autism, is a much debated subject. and it's on the rise all over the world. It is not that suddenly we have become more prevalent to be ADHD. It's just that we have noticed this disability in children, specifically in school. The queue times are extremely long. The waiting time is extremely long. And as you can see in this slide here, in the worst case, it takes from a worried parent and the school is not functioning to up to 6 years until you actually get a working treatment, including drugs. These are just some excerpts of what people think and talk about in the media, but there is a lot of discussion around it, so it's easy to Google. So, to solve this problem, we will not solve, of course, the whole problem, but we will be a part of the solution. So our solution is a 40-minute test where you can actually assess, you can prioritize, you can validate, and you can use it as a second opinion. And before I go on more deeply into exactly what that means, I would like to show you a short clip of what we do and what you can expect.
Introducing SensoDetect
Is there a sound somewhere?
Fast, easy to use, and fully objective tool for detecting mental illness. Based on more than 30 years of extensive research in clinical psychoacoustics at the Department of Neuroscience at Lund University, we deliver a safe and diagnostic aid that has a sensitivity and specificity of almost 90%. Within psychiatric care, SensoDetect Bira improves both diagnosis and treatment efficiency to not only reduce hospitalization costs, but also foremost to improve the quality of life for patients and their families. The technology, brainstem evoked response audiometry, works by stimulating the patient with sound and measuring their brainstem response. The patient's elicited waveform response is measured by surface electrodes at the forehead and mastoideus and is characterized, among others, by the relation between amplitudes and latencies of specific peaks. All patient test data is sent to SensoDetect for brainstem analysis and translated into an audiogram with curves called Auditory Brainstem Response, ABR. The ABR is then compared to a healthy population and to different diagnosed groups such as ADHD, autism, and schizophrenia, where discrepancies in the ABR curve can be related to each of the different diagnoses. Finally, the audiograms are reviewed by a healthcare professional and used as an unbiased support for diagnostic observations.
So I hope that simplified things, or complicated, it depends on if you're a doctor or not. But in basic terms, it means that the technology has been around for about from the 80s, this technology. We have refined it, we have used it for a specific purpose, and we can now use it in many ways in the clinical workflow. So as you can see on the picture here, we can use it as prioritizing and fast forwarding in the early stages when, for instance, a 10-year-old child comes and has problems in school. Then you can help and say, well, yes, it is ADHD or it's not ADHD. Where should I seek my help, and in what way should I seek my help? Then you can also use it as confirmation after the diagnosis is set, because it's important here to say that this is a diagnostic tool that is helping the psychiatrist and the psychologist to set the diagnosis, because ADHD in specific and autism as well is a function. It needs to be a problem in school, for instance, or a function that you can't work in society in the right way. We can detect if you have it, but we cannot say if you have problems because of it. Then, of course, the last place here is the evaluation. It can be used as a follow-up tool to see if the medication or the treatment has worked properly. But most importantly, I think there's a lot of cases out there today where people sense that they have been misdiagnosed before, and then we can give them a second opinion on that. There's also one other, which I will briefly just brush on because I don't have so much time, but this is a very important area, and I think the reason for this area is that we are today, unfortunately, not looking at the organ that we are treating when we're giving prescriptive drugs, which is a really, really bad situation. This is Dr. Daniel Amen from the US. I don't have time to go into much detail about him, but I concur in what he has to say.
Did you know that psychiatrists are the only medical specialists that virtually never look at the organ they treat? Think about it. Cardiologists look, neurologists look, orthopedic doctors look, virtually every other medical specialties look, psychiatrists guess.
So the last part where you said psychiatrists guess is not entirely true, of course. They are extremely competent and good at what they do. And what we're just saying is that why are you not looking at the organ that you're treating in other ways than asking questions and doing observations? And then giving a child a prescriptive drug, which contains also amphetamine, that I might add in ADHD case. So here's just to point this out, is to say that we have done studies on this, and we will release the studies in the springs and the summer. I can say that they've been extremely successful, so we can now soon, I hope, add this into our offering, where we can also establish a baseline for an individual, measure the effect of the drug, and then, of course, also control and adjust the drug so that the curves normalize. So you would get a curve, for instance, for ADHD, you'd get one curve for an ADHD patient and one for a normal patient. And then, of course, we want them to go to normalize towards each other. And that we can do with our method. We can measure the actual effect of the drug. Today, we're present in Sweden, of course. We are connected into Denmark as well. We have a distributor in Bolivia, one in China, one in India, and one in Saudi Arabia. Saudi Arabia will also, of course, cover the whole of Middle East. The other dots are potential distributors that we will reignite. The most prominent one being one in South Korea, where they actually are looking into a research area that we are really interested in, which is dementia. The business model for SensoDetect, the customer would get the device for free. They would, of course, pay a down payment for it, or that will be refundable or refundable payment. And then we charge per use, which goes through our SensoDetect, our cloud solution. The reason why the span is so big here is because 30 euros, for instance, is for expanding it in countries like India. Then you can charge, of course, much more in countries like Dubai and Middle East. The average price today is about 200 euros for the service. Additional equipment will cost, the client can choose to get it from us. That is simple things like cotton swabs and gel and things like that. And then, of course, today the support and training is free, but as it expands, we will also be able to charge for that. I know you shouldn't do this, but I'll do it anyway, because I strongly believe in this company. I recently also invested a large sum, which is, I think, public. But it has an extreme potential. As you can see, the figures, that's the gross of the figures. But look a little bit down, and then you can see that only one unit, that the production cost for one unit is about 15,000 or 1,500 euro. And you can do 1,250 measurements, calculating all the working days. If you do 5 measurements per day, if you do the calculation on the low part, for 50 euro, you'd get around about 60,000 euro in profit for one machine. And if you take the high price, of course, in the same sum, 250. These are also, of course, I would say happy cases, but you can also see the potential of just installing 1 or 2 machines. The forecasts, we will unfortunately go minus this year, but that is because we are in an extreme sale phase. The product ready, everything is ready, is a relaunch, and then we expect it to be positive in 2023. Briefly brushing upon, before I end, we have, of course, competitors. I love competitors because they're door openers. I would like to say that although we are the only objective measurement today that is out there except SPECT scanning, and SPECT scanning is this form of where you insert into the blood and you can see the blood flow of the brain. But that is also very expensive and it's time consuming. Our method is mobile, and I have it in my bag today, actually. Other competitors are subjective ones, Cubitech, for instance, and Tova Company, BrainTrain, and so on. They are all detecting if you have a functional disable of that, problem focusing, for instance, or a problem of keeping into one subject, and so on. So 100% unique, low cost, fast delivery. It significantly reduces the time in the clinical workflow, and it actually looks at the organ that it treats. I will not go into these ones. I hope they're quite clear, but I, for one, strongly believe in this company. 2 reasons. One, as you can see the figures, but also 2 is that it actually helps people around the world in problematic diseases and a problematic diagnosis. That's it.
Perfect, Penser. Thank you very much for the presentation. Really interesting. I do have some questions. We always have questions.
Yeah.
When looking at your plans for the coming years, you're planning to commence sales and you're active in some very interesting markets from the point of view of how ADHD is treated there. What are your thoughts on the cultural aspects on your focus group ADHD in those countries?
Yeah. So I can start with China. It's a country that I've lived and worked in. I have also owned a company and started business there before. So I brought in that connection and brought in them. I strongly believe in that culture, and I strongly believe that you need to actually live in a country and work in a country to understand it. So whatever everyone thinks of China or not, I think it's very important to take in the aspects of what they believe and not believe. So I've taken that into case. When you go to Saudi Arabia and Middle East, it is a very interesting region, different culture. And then you take all the way to Bolivia and all the way to South Korea. Yes, we're taking that into account as well.
If we zoom out from the world and look at Sweden, ADHD, some might say that has been maltreated in Sweden with long queues and all. What is your game plan for Sweden in the future, in the long run?
Yeah. So, as you said, Sweden is it's both good and bad. It's a problematic country because we are extremely well respected as a medical profession around the world, but we're also very conservative when it comes to new technology. So the society as such here has not accepted to use technology in that sense for measuring. So therefore we have started to do measurement clinics of our own. So our game plan has gone from B2B to more to B2C when it comes to Sweden and Scandinavia, actually. So we intend to try to push the service more from that the public wants it, rather than that the psychiatrists are a big skeptic.
Interesting. If I am a prospective patient, if I go to your clinic, what would the process look like? Who do I get to meet? What happens?
Okay, first of all, you can book already today at our webpage, book the time in Lund. We have said that if you have more than 10 patients, we would actually travel to the city that you live in. So you would expect booking, of course, then you get some pre-information, which is really important because you cannot take a medication the morning before. Then you would meet a registered nurse that will go through everything and that you will do the measurement. The measurement takes about 14 minutes, but the total time will take about 45. After that, you would get written diagnosis or non-diagnosis. the assessment of it, so to speak, which you can then use to go to the doctor or to, as for yourself, basically to say that you're on the wrong track or the right track.
Okay, interesting. Also, you are also new in your CEO role since last fall, you mentioned.
Yes.
What do you think have been the biggest challenges for you in your SensoDetect journey so far?
I think the previous people in the SensoDetect have done a great job, but my biggest challenge was to actually put it all together so that we now have a really good service that we can offer to the clients. So I think that was the main. The forward-looking thing is, of course, the sales part, which is you should always have respect for sales.
Of course. And the last question, if you finish off on a little bit of a visionary note, where do you see SensoDetect in 5 years' time?
Well, I see us being established in Scandinavia and Sweden. I think the home market is really important. But I see us also established in China, proven, and in several regions. In India as well. And I also see that we have started and are expanding in the US. So those are my visions. A new question, maybe Europe. Europe or US is of course always a question, but personally I see us more towards US than Europe.
Many do. US is also a much larger market.
Yeah.
Thank you so much, Per-Anders.
And
I thank you for watching. We're going to finish off the day with a talk from my colleagues in another room. Thank you very much.